Doctors, what's the best asking for a friend story you've heard? Story 1. Divorced women or cougars like to explain muscle strains as intimate injuries to get a rise out of the doctors. Best way to deal with it is to stay monotone and not react. Patient describes proximal adductor muscle pain in hip flexion and during recreational activity. Rated 7 out of 10. Pain is now present during ambulation. If you don't react, they move along. Doesn't take long in the office to have seen and or heard everything. I'm not interested that you are recently divorced, started working out, and discovered Tinder. Good on you, but it takes more to get a rise out of me. One colleague in training had a professional cuddler with a similar injury. Doc was very conservative, possibly on the sheltered side, and in front of 2 of his superiors during the case, and she was not shy. I would add she was not visually what I assume most would hope for in a professional cuddler either. That one I enjoyed on account of him, not her. Takes more to get a rise out of me, so what does it take, Doc? Fair question. I have had a few women want to show the way they take off their sports bra because it causes shoulder pain. Of course, I couldn't let them expose themselves because that could cause me some work-related grief that I'm not willing to invite. But on a serious note, if you think about pulling off a wet, sweaty sports bra after a fitness class, the motion is similar enough to a shoulder impingement test. Fortunately, seeing cougar ditties isn't a positive for the test, so you can skip that part. I've joked and considered using sports bra sign as an orthopedic sign, but I'd rather spend time on the internet than trying to publish case studies. As for getting a rise out of me, stroke signs in a patient walking in the door with neck pain would be one, or a patient with foot pain who isn't managing their diabetes because they don't want to accept their diagnosis, therefore causing nerve damage. Patients with cauda equina, numb crotch/saddle region, usually after a car accident, that don't want to take the next step referral, which risks making nerve damage permanent, melanoma and other possible skin cancers. Stuff like that gets my attention. I'm aware no one wants to go in for a torn rotator cuff and come out with a referral for a basal cell carcinoma, but that's the job. So unless their boobs have a lesion that needs to be checked, I'd rather avoid the paperwork. HR is to be avoided at all costs. Asymmetrical shape, border not clearly defined, color not consistent, or multicolored diameter over 6 millimeters, evolving or changing. If you see something questionable, get it checked. Story 2. I'm a veterinarian, and when taking a dog temperature rectally, an owner going, "Mommy doesn't like it either." Oh, I'm so glad my dog is the opposite. Took her in once because she was yelping and limping randomly, and I thought it was because she pulled a muscle, possibly related to a little arthritis she has in her knee. It was heart-wrenching to see her avoid greeting us because she was in pain. She's also a retired pharmaceutical research beagle, and as the veterinarian took her leg through the motions, trying to see if anything was causing her pain, she said, "I don't know if she would complain if any of this did hurt her. She's so well behaved on the table. She'd let us do anything to her." Yes, she absolutely would, except for nail trims. Blood draws, urinary draws, thermometers are all fine, but don't touch her paws. We had been using Valium for nail trims, but based on her history as a working dog who still responds to handling as a cue to stay perfectly still, we decided to start using a Thunder shirt. She seems to be doing just as well in a Thunder shirt as with Valium now. Double points if it's the male owner who says that, and the wife and girlfriend in question is right there beside him making a face that tells you he's in the crapper as soon as they get back out to the car. Story 3. Not a doctor, but a public health worker, kind of a weird one, had an older man come into our clinic asking for a specific type of STD check. Guy's ex-wife was going around telling rumors that he was doing it with his goats, so was wanting to know if there was a way we could do an STD test that could prove if he had or hadn't done it with any of the goats. Through this whole conversation, he just abruptly asks, "So if someone was doing it with a goat, what STDs could they get?" That dude is totally doing his goats. Doesn't sound like a rumor to me. Story 4. Another family medicine doc called an ER doc yesterday on the cell phone asking what to do when you get soap in your eyes. Choose wisely, folks. I mean, it says so on the bottle. In case of contact with eyes, rinse thoroughly and contact a medical professional. Better safe than sorry. I wonder how you grow up to become an adult without ever having gotten soap in your eyes as a kid. That stuff happened every time I took a shower, and that dang shampoo bottle lied to me. It did hurt. Story 5. Not a doctor, but a pharmacist. Someone called the pharmacy one day, a young guy. I picked up, "Excuse me, how much does Viagra cost? Is there anything cheaper? I have someone that needs it." I explain everything, and suddenly, "Will it work if I take it with alcohol?" The guy began asking for someone else, and in the end it was for him, just because he wanted his little one to work while drunk. So, does it work? Asking for a friend. It'll stay up, but you probably won't be able to finish. Also, don't take things that mess with your circulation blood pressure on top of alcohol. There are easier ways to have a really dumb night out. Story 6. Not a doctor, but I was an intern. I was in the OPD, and this man from a different province came in and told me his friend has injected petroleum jelly in their member years ago, and that now it's getting painful. Yeah, he came back the next day and showed his lumpy member. For clarification, this is done to increase girth of the penis. This is a common thing, apparently. Saw a patient who did the same, had to have his penis reconstructed. He told everyone it was worth it. What? What does it achieve? Story 7. I was asking the following. So if I swallow jism and flush it down with vodka, do I still get pregnant? She was in her early 20s, and she waited for her actual friend who broke her nose in a bar fight. Actually, I'd say the odds are pretty good. I couldn't contain myself. I was just an intern, and she sat in the waiting room, not a patient. So I asked, "How much did you swallow?" She said that he came twice. So I said that vodka saved her. Story 8. I asked my doctor about AA for a friend of mine. Really. Years later, the doctor still asks me how I'm doing with my sobriety. I've stopped trying to convince him I really was asking for a friend. So how are you doing? Staying clean and all? Story 9. Wife's dad is a urologist. When we first started dating, a friend of mine wanted her to ask if any of the wiener enlargement pills were legit and actually worked. She went with the asking for a friend approach, and he immediately assumed she was talking about me. Thanks, babe. So do they? Asking for a friend. He said no, but I think your friend should try anyway. Story 10. Studies have been done about the effects of THC on glaucoma. When I worked for a glaucoma specialist, we had a hippie-type person come in with their family member for a new patient eval and ask the doctor to sign paperwork okaying a medical marijuana script for the patient's glaucoma. Problem was, the patient was totally fine, didn't find any signs of the disease, and his eye pressure was within normal limits, and the doctor did not appreciate having someone try to trick him. To piggyback off of this, and because I'm tired of the questions, marijuana only lowers your eye pressures for max 4 hours. To have sustained effects, you'd need to hit the blunt 6 times a day and nearly 2,200 times a year. Take the dang eye drops. I know a lot of stoners that would take that as a challenge. Story 11. Not a doctor, but heard this one from my cousin. A guy comes in and asks if it's possible to get a girl pregnant with someone else's sperm if guy A does it with guy B before banging C female. Wish I knew the full story. Can't be sure, but my guess is that guy A had done it with guy B before banging C female. Yeah, but in what configuration could there be leftover sperm on the guy's dong? If there was, and it was a short enough time frame, like maybe less than an hour, it's marginally possible, right? Like maybe 5% chance the girl gets pregnant if their birth control is iffy that one time, and like 0.1% chance that the other guy's sperm outcompetes the guy who's actually doing it? Or is it not possible at all? Story 12. Not a doctor, but I saw this dude say to a doctor, "Can 2 white people have a black child?" Asking for a friend. The man's wife had an affair. Edit. The dude had the baby in the stroller, and when he was walking out, he looked like he was going to yeet the child, and I was secretly dying inside. Oh, that's rough. He must have had so many emotions running through his head. I wonder if the guy ever suspected anything before his wife gave birth. Wonder why she's always watching Medea movies. Story 13. ER doc had a guy who just got out of jail a few days earlier, came in with his girlfriend who had signed in for an STD check. Walk in to meet them, and he says, casually, "Is it possible to get gonorrhea in your throat?" At that moment, I knew he had gonorrhea in his throat. So how would my friend know if he had gonorrhea in his throat? Having a very wussy throat. Story 14. Yes, hi, this is Dr. X. I need to call in a prescription for hydroxychloroquine. Do you have any in stock? Asking for a friend. I have lupus, and while I no longer take Plaquenil for a couple of reasons, reading about how doctors are writing themselves and their families' prescriptions makes my blood boil. There are a lot of people who legitimately need it for autoimmune issues, and they can't get it right now. We're already at higher risk for COVID. Now we have to try not to catch anything while flaring. Ditto, but I don't take it currently because of the side effects. These people taking it, thinking it's going to prevent COVID, are in for a nasty surprise. Story 15. Not a doctor, but was mistaken for one by a drunk dude at a costume party once. Okay, twice. Sent him to sober up the first time, comes back 5 minutes later with no recollection of our first conversation and asks me for painkillers, and at which dose they kill you. I gave him the number for the seppuku prevention hotline on a napkin and told him that they can help with the issue. He happily staggered away, and I haven't heard from him since. Either he got help or he didn't, but either way, it was a weird experience. Story 16. My father is a doctor, and he got a call once in the middle of the night from his call share doctor's patient. The man asked what to do about a bump on his friend's arm that he scratched and something came out. He mentioned it was leaking a little oil now. It was a zit. He scratched a pimple. Woke the whole family up at 3 a.m. because he had to page my dad over a zit. How old was this man? 13. Story 17. I briefly dated a doctor, and she told me a few hilarious stories. Number 1, if my friend touched herself with someone else's vibrator, will she get an STD? Number 2, can wearing a butt plug all day give you diarrhea? Number 3, if you have an ulcer and swallow a guy's jism, can you get pregnant? 2 out of these 3 seem like somewhat legitimate questions. Seem like valid questions. Story 18. One of my besties called me late at night after his birthday party. He said someone who was staying the night wanted to sleep with his girlfriend. They were drunk and a little uncoordinated, and somehow the frenulum, the little string thing at the tip of the penis, ripped, and it won't stop bleeding. I gave his friend some general advice on stopping the bleeding and recommended a trip to the ER. The next day, he asked me if I had any recommendations for urologists for his friend, because he needs minor surgery on his pee-pee. I told him to cut the BS, and in response, he sent me a pic of his injured wiener. So, long story short, his wang got remodeled, and he is still with this vagina dentata sporting woman. Story 19. General practitioner here. One of my non-medical friends asked me if his friend wants to know a good home remedy for an STD. I told him a tablespoon of powdered detergent mixed in 1 glass of water should work. Next thing I know, he's in my kitchen stirring a glass. What exactly is this remedy for? Asking for a friend. Getting the stains out of your underwear. Story 20. One girl was interested in laxatives for a friend. She tries to learn everything about the dose, where to buy, how to drink. She was brought in a week later with complete intestinal atony. She tried to lose so much weight and drank 2 or 3 tablets at a time. Oh, I have more stories like that. Hope you got better. Story 21. So, not me, but a person I saw. So the patient, sick as heck, staggers to the doctor and, in the absolutely loudest possible voice, she says, "Are you single? Betty wants to know." Betty was her childhood pet cow. The doctor calmly says, "I'm sorry, but I'm not interested." We were all busting out laughing, and I barely could breathe. I later asked the doctor how he kept a straight face, and he said, "Laughing on the inside. It's a lot like crying on the inside." That is now the hospital I frequently visit. I am not a doctor, but I used to work next to AA pharmacy, and my boss, a 55-year-old man, asked me to go buy him some condoms for his nephew. Story 22. Asking for my puppy. I took a class in medical parasitology. The professor, a PhD in parasitology, once had a very concerned neighbor bring him dog poop that had human pinworms in it. He suggested the neighbor take his puppy to the veterinarian for some albendazole and assured him that the infection would resolve. Pinworms are still a common and very treatable infection, even among first-world children, but not puppies. Story 23. Not mine, but one of the older pharmacists I work with went out to help this 20-ish-year-old girl with some med questions. She then asked him about condoms and said, "If you were to do me, what condom would you use?" Yeah, he just walked away. All 12 of them, at the same time. What a king. Story 24. Middle-aged woman ordering a poop ton of comfort food at our KFC drive-thru and then adding, sometimes multiple times, that it's not just for her. It's usually the contrary that happens to me. When I get food delivered and discover that they put cutlery for 2 in the bag, nope, everything's just for me. Story 25. Lady walks in and goes, "So if you cheated and got pregnant, but then did it with your husband, would the baby become his?" It took everything in me not to laugh. I would have pooped myself laughing. Go on, we're watching. Story 26. When the patient woke up, his skeleton was missing, and the doctor was never heard from again. Anyway, that's how I lost my medical license. Archimedes, no, it's filthy in there. Story 27. Do you sleep with hot male patients? Asking for a friend. Kind of you to ask for a friend, since you obviously aren't asking for yourself. If the answer is yes, do you sleep with ugly male patients? Story 28. Doctors are all busy at the moment. And I was sure the top comment was going to start with, not a doctor, but shh. Story 29. Who are you asking for? A friend. Hey, I'll be your friend. Story 30. Not a doctor. Shh. From Mulan. Get out of my head. Story 31. I'm directly related to a nurse. More than once, I've approached her with a question for a friend that actually was for a friend. Please leave your stories in the comments. I'd love to make a video of them in the future. Also, don't forget to like and subscribe.